Afternoon or good morning. It's Saturday and it's Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and I am back. Last week I was a bit down, just suffered with some gout. I mean, I'm getting old, so I had a bout of gout, and anybody who's had gout, man, you know it can knock you down. So I'm back. I'm feeling much better. And I wanted to just join and kick this Saturday off with some open discussion. I would love for you to join on and invite friends for this 30-minute or more, depending on how much engagement we get. Session. This is a Q&A session to ask your questions about plastic surgery. I am a board certified plastic surgeon, like I said, in Atlanta, Georgia. I have nearly 2 decades of experience. And I really want to kind of spread truth and transformation. A lot of plastic surgeries out there in the interwebs, and you don't know what's what, who's who. And I'm here to kind of help guide you through that. But really, I want to work with you. I'm a guy who loves to engage with people. I have a gift, I like to believe, and I like to share that gift. So if you're interested in this resonates with you, stick with me for about 30 minutes, invite your friends, invite other people that may be interested, your coworkers, and let's chop it up here for the next 30 minutes. When I started Hot Seat Saturday, and I'm evolving, I really had a really regimented kind of schedule. I wanted to do this, I wanted to do that the next Saturday, I wanted to do this in a third on the following Saturday. And what I realized when I was sitting down or kind of laying down with my leg propped up because of gout is that I just have to be fluid and I have to go with the flow. I have to speak to things that resonate with me as a professional and as a plastic surgeon that I think may confuse people or may be of topics of interest. So instead of talking about face this week and eyes next week and tummy this following week, we're going to just pop off with things that are interesting. So, to that end, I was surfing around on the social media platforms and I saw this TikTok video and I thought was very interesting. I actually saw two. So, let me pull those up for you. I am my own producer, so you'll see me kind of look down from the screen. So forgive me. So here we go. Here's the first video, and I'm gonna play two of them. I'm gonna play them back to back, and then I want to discuss them. So, and I welcome any comments. Please, this is for you, and I would like to engage with you. And if we have dialogue, it makes it just that much more interesting. But you can sit here and listen to me talk. I'll be happy to do that. So, with that being said, first video.
Not just maybe, not.
Here we go.
I'm saying the skin retracts back every single time, not just one time, not just maybe, every single time, not just one time, not just maybe, not.
Okay, video one. Video two. If you get the drift, we're talking a little bit about.
You can do it under local anesthesia. You don't have to go under general anesthesia.
Oh, wait.
Most of our patients.
We got to back that up.
Know about a tummy tuck. One, there's rarely anything better to get rid of a baby belly, get rid of those extra stretch marks and that extra skin. That's the most important thing. Another thing that's important to know, though, we can do it under local anesthesia. You don't have to go under general anesthesia. Most of our patients sleep through the tummy tuck with mild sedation, but they can awake anytime we want them to. Third thing to remember is it is important that you avoid lifting after the procedure. We don't want to pull apart the wound, and so be careful of how much you lift.
All righty. So let's talk about tummy tuck, liposuction. Let's kind of dive into that. And I'm going to pop up that first video again and we'll run through.
I'm saying the skin retracts back every single time, not just one time, not just maybe, every single time, not just one time, not just maybe. Not.
Okay. Great way to pause it right there. Perfect production manager. Thank you. So, having said that, a person who has liposuction is counting on that skin to retract back to their core. That's if, and works best for them, if the skin is healthy to begin with. And what I mean by healthy, it hasn't been stretched beyond its capacity or capability. It has no stretch marks. It's really smooth and supple so that when you remove the excess fat or the volume, that skin retracts back very smoothly and evenly to your core. A person with fat in areas of the hip and the tummy that have a little bulge here and there that are basically, want to be better contoured, with good skin that hasn't been stretched, doesn't have stretch marks, is really a better candidate for liposuction only. In this video, I believe, and I don't know this person, I believe it's a bit kitschy, a bit kind of sketchy. Yes, the skin retracts back every time. I agree with that. Do you want it to really retract back like the bottom picture? And so you don't really want that. I've talked to thousands of patients, and when they talk to me about their tummy, they really have in their mind that their tummy is smooth and sleek. And if it's a man, athletic. If it's a woman, it's sexy. Again, expectations are everything. You talk to the client, you figure out where they are, you meet them where they are, you offer a recommended treatment that gets them where they want to go. Having said that, the client is looking for you or me as the expert to give them the optimal, the best, the Cadillac treatment so they can look their best. When you offer liposuction to someone who has had a baby or babies, where the skin has been stretched, the muscles been stretched, surely you'll change their contour, but you won't change it maximally. And I don't, again, know this person down below, the result. It's better than it was before, but is she really going to be proud of that? Is she really going to wear something, let's say, in a tropical destination that maybe is a nice two-piece that shows a little bit of her midriff? Probably not. Does she look better in clothing? Sure. But she's probably not going to be able to maximize that result because her skin didn't have the right characteristics for liposuction only. So she was probably better served with a tummy tuck. So the age-old question is, Doc, do I need liposuction or do I need a tummy tuck? And the answer is yes and yes. Typically, if you have stretched skin, you have stretched muscle from babies, from massive or significant weight loss, you're going to need removal of that excess skin and you're going to need reduction of the fat. So you need both, not one versus the other. So for patients to present like this, and I'm going to run the video one more time so you get what I'm saying. For patients
I'm
like
saying
this,
the skin retracts back every single time, not just one time,
that
not just
person right there
maybe,
needs a
every
tummy
single
tuck.
time, not just
Yes,
one
it's
time,
better,
not just maybe.
not maximized, not maximized at all. And if you're spending your time and your money and effort of healing, I think you want to get the most bang for your buck. So, first issue here, liposuction is not the end all and be all for all patients. Two, and I'm going to point out in this video, this patient's awake, and we can touch on awake liposuction. It has its place, just like everything in plastic surgery, but it's not for everybody. And it's not for every situation. And that's a topic we can talk about a little bit later, maybe in this Saturday or Saturdays to come. But what I really want to press upon here is that the skin for these clients, when they presented, was beyond what liposuction can create, as far as, in my opinion, an outstanding result. We just don't want acceptable results. We want outstanding results. So that's the first video that struck me when I was recuperating last week. So let me pull up that second video again and let's look at this one.
3 things to know about a tummy tuck. 1, there's rarely anything better to get rid of a baby belly, get rid of those extra stretch marks and that extra skin. That's the most important thing.
So on that point, I agree with him. If you want to get rid of stretch marks, if you want to get rid of that extra kind of belly fat and that Dunlap over your belt, then a tummy tuck is the best option for you. It's going to give you the best contour. He is absolutely correct. So I agree with that young man on this point. So let's roll.
Another thing that's important to know, though, we can do it under local anesthesia. You don't have to go under general anesthesia. Most of our patients sleep through the tummy tuck with mild sedation, but they can awake anytime we want them to.
All right, I'm going to call, we're going to have to hold it up right here. We're going to have to hold it up right here. I don't agree wholly. And let me be very clear as I channel my inner Obama. Let me be very clear. You cannot have a tummy tuck awake. Let me say that again. You cannot have a tummy tuck awake. Why would you want a tummy tuck awake? I don't understand why you would want that. You can, and I was even trained, have a tummy tuck under very, very deep sedation. And what's that mean? You come in, you have all the processes like you would normally have for a general anesthetic. IV is started. You're taken back to the operating room. You're prepared in the usual manner as you would be for general anesthetic. And the anesthesiologist or the anesthetist gives you medications that put you really in a very, very, very deep state of sedation. And what's the tipping point? You're close enough that you can maintain your own breathing, but just not far enough that would require someone putting a tube down, breathing for you, controlling all or most of critical functions, or at least monitoring them. So you're really, really, really close, but not close enough for general anesthetic. In select cases, for select clients, that may work. For our usual, I'll say my usual clients that require a little extra work, a little extra oomph, then I feel as a professional, as a board certified plastic surgeon, that general anesthetic offers the best form of pain control and best form of an environment to allow me to do what I need to do. Because I need to remove the skin, I need to tighten the muscle, I need to liposuction, and I need to be fairly convicted in doing those things. And I need to be very efficient. When patients are sedated, and usually a lot of them are lightly sedated, they're not sedated to the near edge of general anesthesia, but they're usually sometimes sedated much lighter than that. And they feel that, and it hurts, and they move, and it becomes a quirky kind of awkward dance. And I'm the kind of practitioner, I don't like to hurt patients. I want patients to be comfortable. I want you to sleep and get the best sleep you can. That allows me to get in there and do my work, and bam, it's efficient, meaning that in my hands, if somebody's hurting and we've done light sedation, or we've got a light sedation or near deep sedation type of scenario, and you're moving and hurting, it causes me to kind of retract back and not be as aggressive, and maybe not produce the result that could have been produced. And then it takes me longer because I'm concerned, and am I hurting you? Is this going to be all right? And so a tummy tuck that may take 3.5 hours with liposuction, or 4 hours with liposuction, now takes 5 hours. or 5.5 hours. I'm just throwing out numbers, but you get my point. It takes longer. So what's that mean? It takes longer. You don't get maybe quite the result you could have because the plastic surgeon may be treading lightly. And because we took a little longer, your recovery is going to be a little bit more difficult, a little bit more challenging. It's going to take you longer to bounce back. You're not going to be able to get up and move around and bounce back and be where you want to be at club blah blah blah, out for dinner, at the beach in 5 days. Don't believe that. So I'm gonna disagree right here. Do not, and I repeat, do not have an awake tummy tuck. If your physician, your plastic surgeon, let me be clear, your plastic surgeon believes that you are a good candidate for very deep sedation and a very routine tummy tuck, if I can use that terminology, then sure, entertain that, ask the questions you need to ask, get second opinions, and see if that lines up. But for the majority of my clients, and I'm gonna say clients, general anesthesia is what you should have. Have general anesthesia. You're asleep, you're comfortable, you're well monitored. I do what I need to do, and I don't have to worry about you feeling anything or remembering anything. So it allows me to give you the best result. So last part of this video, let's roll that.
Third thing to remember is it is important that you avoid lifting after the procedure. We don't want to pull apart the wound, and so be careful of how much you lift.
So yes, that's true. I mean, that's kind of a soft thing to say. Of course, you want to be careful of the incision. You don't want to kind of have this procedure and then go about, lifting and doing vigorous things to one, cause more pain, which is probably going to be the most likely scenario, which can prolong or make your recovery miserable. It's unlikely that the wound's going to pull apart unless you do something egregious. You're trying to lift 100 pounds and you weigh 120 pounds. That type of force and that type of strain can disrupt a tummy tuck incision. And I often hear, my stitches popped on my plication. That type of force can. Lifting your computer, maybe even lifting a child will not. But we still, regardless, want to be very careful of the incision so that one, we keep it together. Again, it's rarely going to open with typical or a little bit above typical stress and strain, but we still want to be protective of that. And we want to be protective of the muscle plication. So for sure, we want to make sure that those areas, the incision and the muscle tightening, are preserved and protected. So to his point, tummy tuck's best procedure to remove excess skin and fat and stretch marks. Agreed. Tummy tuck awake, no. Tummy tuck with deep, deep, deep sedation, well monitored, possible. Not out of the question, but not typical. General anesthetic for tummy tuck is really in my opinion, the standard. And lastly, we want to be protective of the incision and protective of the muscle plication. I do agree with that. Typically, your plastic surgeon will give you instructions. I like for my patients to walk immediately after surgery. I like them to maybe sit in a chair, lift certain things like their glasses or a cup, but not try to get out there and get in the yard and move a bunch of stuff, do gardening, try to get up on a ladder and kind of dust here, there, and everywhere. We really want you to take care of yourself, be protective of yourself and protective of the operation. So definitely, definitely, definitely want to be cautious with that. In addition, I give my patients a binder right after surgery, not a faja or a garment, and that's my preference. And again, that's a discussion for a whole nother Saturday. It's personal preference, but I do give you a binder for support. So that helps support you, makes you feel better, helps support the incision. And then obviously we transition our clients into a garment in about a week. So Interesting things. Don't believe or question, better yet, question what you see on the interwebs. So I'm going to show you a patient that in these two videos probably would have had just liposuction, at least for the first one. And probably in the second one, this physician who's not a plastic surgeon, both of those practitioners are not plastic surgeons, would have offered maybe deep sedation. So let me show you a case that I did. So here you go. Here's one of my cases. So as you can see, this lady doesn't like her tummy. She doesn't give her confidence. She can't wear what she wants to wear. She doesn't feel good about herself. She has excess skin and stretch marks and excess fat that gives her, contours that she doesn't like. So she just is a good candidate for a tummy tuck. In the first video, the first gentleman would have offered her awake liposuction, especially if she espoused that she's afraid of the incision, which a lot of clients are. And I understand that. Sometimes people can't wrap their heads around that. There's nothing wrong with that. But as the plastic surgeon, board certified, I can explain why that's necessary. I need that length to give you the contours that you need. I can't make an incision this small or an incision this small, I'm being silly, and give you the silhouette that you want. It requires that. That has to happen. And the incision is not uncomfortable. It's just a representation of the work we needed to do. So he would have offered her awake lipo. The second gentleman would have offered her a tummy tuck, but again, under deep sedation. I did this on a general anesthetic because I got to take down that skin. The skin that's above the belly button needs to come down way down toward her pubis. I've got to contour her waist with, fairly aggressive liposuction. I got to contour her tummy above the belly button with liposuction. I've got to tighten her muscle. And that is, in my opinion, for me, in my hands, challenging under deep sedation. This is not a deep sedation candidate. This is a general anesthetic candidate. So, having said that, here is her result. Now, the lighting's a little different, and I'm working on this. These are older pictures. Uh, and again, another subject. Pictures are important, of course, before and after, but they need to be standardized or as standardized as possible. The same magnification or distance. They need to be the same, have the same lighting or temperature. And this is an example in my case that I didn't do that. So I just wanted to let you know that this is the same person, even though the skin looks lighter, because the lighting is different. And in my new version of my rebranded version of my website, we're cultivating our pictures to represent that. So this is her result. I mean, you can tell she feels good about herself because look at what she's wearing. She's wearing a nice red bra and some red panties. Before, she didn't feel so great about herself. She's wearing a standard bra and maybe a little bit of kind of some spicy panties, but she's not feeling real great about herself. She's feeling pretty good about herself now. She's wearing some nice intimates. So she feels good about herself. Her shape is, you tell me, her shape is improved. I'm going to say that. It's improved. And that's not going to happen with liposuction alone. Not going to happen with liposuction alone. It is just not. And it's probably, and I'm speculating, it's probably not going to have this contour and its shape under general anesthetic. Under deep sedation. What am I saying? Under deep sedation. That's just my opinion. Doesn't mean you can't, but just my opinion. I work more efficiently under general anesthetic to produce this. I'll say that. I work more efficiently to produce this with general anesthetic. Now, this is a 3-month result. She still has some additional healing, additional contouring that the body will will provide, particularly in the realm of her belly button, and it will continue to shrink down. But nonetheless, she's thrilled, absolutely thrilled about that. So be wary when you're on the internet. This is why I am doing what I'm doing. I'm here to provide you a sounding board, a platform. You can ask these questions. You can kind of get things straight. You can kind of make the best decision for you. And if you've made that decision and you know what you want to do, I invite you to kind of continue this dialogue with me. I would love to be your plastic surgeon. So be aware out there and be wary of what you see and question it. And come to Hot Seat Saturday and ask the questions, and I'll be happy to take a deep dive with you and we can figure this thing out. So, again, my name is Earl Stephenson Jr. I am a board certified plastic surgeon. I'm certified by the American Board of Plastic Surgery. I'm also an esteemed member, if I can say that today. I'm a member of the Aesthetic Society, which is a society for board certified plastic surgeons who focus on aesthetic surgery. If you would like to join my Facebook group, I encourage you to do so. It's really simple. I have a Facebook group called Beauty by Design. There's the link below. I'll provide it in the comments. I encourage you to leave comments for this video or comments about things that you want to hear about or know about. If you are a lady, I have a private Facebook group for my ladies or for women interested in aesthetic plastic surgery. It's a safe space that we really can dive deep and take a look at all things plastic surgery and answer your questions. And within my community, there are many more things that I offer. I'm going to offer this month as February, the month of love. I'm going to show you a bunch of love in the community and look for things to happen in the community that will reflect that. So join my Facebook community. And lastly, finally, guys, finally did it. I finally got a men's group on Facebook. I have a Facebook page and a Facebook group or community, and I'd like you to join that. So here's a little promo. So here's my Facebook page. I ask men to join and be a part of that. Focusing on aesthetics and men's health. If you want to take a deeper dive with me in the private men's Facebook community, that men show up. We don't talk about things to one another. We don't talk about things to our wives or our significant others. So I encourage you to join my men's Facebook page and my men's Facebook group. So again, I'm Earl Stephenson Jr. It was great to have you on. I hope you join me next Saturday as I continue to recuperate and continue to craft this Hot Seat Saturday to make it better, more interactive, and really more informative for you. Remember, there's truth in transformation and truth and transformation. So until next Saturday, enjoy your weekend.